welcome back to Community Chronic Ills. Today we have Ritchel with us. I'm Maddie.
And I'm Kyle.
And that's your cue. Now,
I'm Ritchel.
we didn't practice that. And today we are going to be talking all about kind of your health information and the importance of keeping that secure. All right, Ritchel, talk to us about yourself.
Yeah, so I'm a technical advisor here at Community. Came on it's been about 2 months now officially. It's been good. You know, I met Kyle and Maddie. We've talked a little bit, and this is actually the first time we've actually gotten to the nitty gritty of things like security as far as health is concerned. So a little bit about myself. I started out working on the blockchain, but as a freelancer. So I did a lot of work for a lot of different companies that took place over a course of about a year. So I worked for companies in Australia, Germany, a lot of companies in the US. So I have a lot of experience in that. Well, I say a lot of experience. Some people might not say a year is a lot of experience, but I say so. As far as currently, I've stopped working on the blockchain and now I work more in stock and finance. And so, you know, security is a big aspect of that because you're handling people's money.
Sure.
You know, people do not like to lose money. So that's definitely a main concern of ours. So these days I'm definitely in that space. But I believe I have a lot to offer as far as health security goes because I understand the implications of leaked data when it comes to personal data. So we can talk more about that, but that's pretty much all about me.
And I met Ritchel at Twin Cities Startup Week, and we got to have lots of fun and learning and drinking.
Yeah, it was a really good time.
It was a good time.
1 week felt like a month. It should have to be a day. I guess a day. If it felt like it was shorter, that means it's better. So
yeah, it was a good time. So that's how I met Ritchel, because we're here in Wichita, Kansas, and he's in North Carolina, but we met in Minnesota.
Yeah, that was one week I'm jealous that I didn't get to go to, but it looked a lot of fun. I guess.
Yeah, next year you'll be there, right?
Yeah, I will. Hopefully, that's the goal.
Nice. Okay.
All right. So the big thing that people talk about with health information is HIPAA, obviously, and I have, you know, a little bit of background on the way HIPAA works in a clinical setting. You know, when we're dealing with patient information, whether it's printed or on the computer, you know, there's so much reinforcement on, you know, making sure like everything is shredded and everything is turned over so no one can see if they're walking by, and using screen like blinders, things like that. And then obviously never using any identifying information or talking about people's names, things like that. But then obviously those things have human factors. And when you think about it, sure, like humans make mistakes, humans, you know, mess up. But when you have all that information sitting, you know, on a computer in a database, kind of tell us about the non-human kind of element of health data.
Right. So you mentioned having all the data in a database on a computer. So the idea, basically what we've done is if we talk like let's say 1960, where we had just lots of filing cabinets storing everyone's data, right?
Sure.
You know, hospitals basically had just an entire floor dedicated to just files, right?
Mine was 700 pages.
Oh my goodness. And that's like just for one person, right? That's, imagine like an entire city just has all that information, right? It's a lot. You know, thankfully we have the digital age now where we can store things digitally. But the idea nowadays is, you know, you're always going to have the human error because humans use computers. But what we want to do is, you know, release most of that access from humans and put most of it in the hands like a computer.
Sure.
You know, it's not foolproof, I will say that, but it's better than humans because computers can handle access more consistently than humans. That's the key word, consistency.
Okay.
And so if I want to get in more detail, I don't want to get too technical just because I have a tendency to do that. But essentially, whenever we're storing things in databases, we basically only want humans to be able to access the database to either retrieve information or put new information in. Those are the main two things. And so there's a lot of ways we can do that. Traditionally, so the traditional view, I'm not going to talk about blockchain yet. I'll mention that later.
Okay.
But traditionally, what we do is we essentially give the whole, username and password thing. But we only give it to people that we know are responsible, and that's up to the company to do.
Sure.
So if we're talking about healthcare, you have a few people, let's say a hospital, right? So a few people in the hospital will have like credentials to access the database. And it's up to the company to make sure that those people, that their username and password don't get leaked. However, we do have ways to mitigate like failures in case those do get leaked. And that's what happens on the computer side.
So tell us a little bit about like dual authentication. How does that dual authentication, like how does that provide more security compared to just a username and password?
So unfortunately, hackers have figured out how to exploit the username and password because apparently it's it's the human side, right? So not everybody creates the best password. Oh, I saw a look over there. But some people will use passwords like password 123, or they'll use Philadelphia like a Philadelphia football team or something, right? It's not good practice, but people have to remember it. So it is what it is. Essentially, what we can do with two-factor authentication or multi-factor, however many you want. Two-factor seems to be good enough for now. But with two-factor, what we can do is we can have the username and password just like usual. But we can also send a notification to your phone, and then once you have the notification on your phone, you're required to then approve the access. So if you're logging in from, let's say, Wichita, right?
Mhm.
You have your phone, and it says, okay, log in from Wichita. That's you.
Yeah.
But if you get a notification on your phone of someone accessing from like, let's say New York, and you're not New York, well, we've got an issue because someone's trying to be you.
Sure.
And so we can prevent hacks that way if we have people see the notification and we can reject it. So there's like a second layer of defense there.
Okay. So is it effective at preventing more hacking?
Definitely effective. But I would say the more sensitive your data, the more layers you need.
Okay.
I would say more than 3 is probably overkill. But definitely every health institution should have two-factor. There's no excuse to still use username and password.
Yeah, no, I totally agree with that. I guess, going from there, where is like the future of healthcare going? Where do you see, the healthcare system in 10 years and, 5 years, even, 20 years, which is still a lifetime. So like, where do you see it going from your experience being in that healthcare field?
Yeah, okay, so this is where I make a prediction about the future, right?
I love it.
Of course.
Don't have the
Get your crystal ball.
I know, right? I have a lot of prior knowledge. That's my crystal ball.
Perfect.
I definitely think there seems to be a trend now where instead of storing information on like so right now we do have databases, and databases are good, but
Hold on, time out. What's a database?
a database essentially just the filing cabinets, but on a hard drive.
Okay, so is that like a physical?
Yeah, it's like an actual like in your computer you have a hard drive.
Yes.
Well, a database is essentially just a computer that has the hard drive, but they offer the space to store files instead of just use it.
Just in case people don't know what databases are. I of course know what a database is.
Definitely. You're thinking of other people. That's good.
Thinking of other people. Always. Okay,
But,
continue, sorry.
Yeah. Okay. So predicting the future, right? I think that in the future, blockchain's really, really taken off. I should clarify there's two types of blockchains. There's a public blockchain, which is sort of empowering people to do things without bias from centralized authorities. But there's also private blockchains, which I think is where healthcare is really going to see the most usefulness. So if you have a private blockchain, you can actually identify records with a person's, we call it like a cryptographic key. So you can assign every patient a cryptographic key, which is essentially like, if you remember during like World War II or World War One, we basically sent messages to people, but we scrambled it so that only we would know what the message was, right? So we can assign every patient like a cryptographic key that only, like, for example, the hospital can decode. And so instead of storing people's data in like a traditional database behind like a username and password, we store it behind a cryptographic key that we only give the hospital and the user access to.
Okay,
So
so
in
for a
the-
dumbed down version,
Yeah.
it would be, a string of numbers or letters
Mhm.
that then when it goes into the hospital side, they can translate those and then identify it with a patient. Is that how it
Exactly.
works? Okay.
Yeah. And so the idea is if someone were to hack into, so essentially the private blockchain is the same as the database. It's still storing all their information. But if someone were to hack into it, they only have access to one person's data, rather than if they hack into the database, they have access to the entire database.
And would that be, especially, from my blockchain knowledge, would that help with, I know a big thing with blockchain is knowing if things were tampered with. And
Yes.
having that ability to easily detect that, this person's data or that, whatever was changed or tampered with, is that the same as well for the private blockchain?
Yeah. So essentially, the way the blockchain works is you have blocks connected, and so every block records the history of the previous block.
Okay.
And so what happens is if someone manipulates this block right here, essentially whenever you decode it, it won't match the previous block. And so if it doesn't match the previous block, someone tampered with it.
Okay.
So as opposed to kind of right now when there are data security breaches and, you get those mass emails of like to every single person that's been having their data stored, by the hospital. And they're like, hey, we had a data breach. We're not sure if your information was a part of it. Blockchain would be able to single out what individuals were affected.
Yes.
Okay.
We would know exactly what was affected.
Whereas, in the same, not only for hospitals and their data breaches, but also like financial, what was it, Target a few years ago that had like the Target credit card got breached? But you never know if your information was a part of that.
Yeah.
Right. And so everyone just has to recycle their data. Yeah, it's really, it's really scary. We're never going to have a period where we're not going to have hackers. It's always going to be like that. So the best thing we can do is, arm ourselves with knowledge and then apply that knowledge to, fix those challenges. So
Yeah.
And why is, your health data being protected? Why is that important?
So that's the thing about humans, right? In order to, work on humans and, fix them, you have to understand, what builds them up, what they're made of, right?
Mhm.
But essentially when you have all this information about a human, you have what defines them almost. Of course there's more, we can get philosophical and talk about defining humans. But essentially if you have like someone's blood type, parts that are like genes and DNA, that's really, really private information that, can really determine how people see you.
Sure.
It can determine like what opportunities you can get.
Sure.
And it's really unfair if someone like a hacker gets the opportunity to expose that and then people make a judgment on that person without their consent. That's a really, really big deal.
And especially with disabilities, like we've talked about the discrimination in the workplace of, so many people with disabilities are afraid to disclose that they have disabilities. And so they're not able to get the accommodations that they need. They're not able to go to their doctor's appointments, things like that. And, if your diagnoses were to get leaked, some of those judgments could affect people's ability to, pay their bills, or
I think there's also just like a lot of silent judgment that people put on, and they may not put it out in out with what they say, but I think the way people look at you sometimes can be differed from just knowing some of those information, which I don't think is right, but I think sometimes there's even unbiased, unhuman bias.
implicit, what is it? What's the
guess-
bias? It's like implicit bias. No, it's
Unconscious bias.
thank you.
Subconscious, that's the word.
No,
Yeah.
unconscious.
Unconscious.
One, like both of us have narcolepsy now, and like when people find, because we're both pretty open about our diagnoses, but like when people find out that you're narcoleptic, they're like, so do you just like fall over and fall asleep? I'm like,
No.
that's not how, like, you know what I mean? I mean, a lot of diseases also have so many misconceptions behind them. And I mean,
And especially like if you're trying to get a job and these people don't know what your disease specifically is, somebody may look at it differently, thinking that I'm just gonna fall asleep randomly, other than what it actually is. So I think that could also affect, the long-term jobs, stuff like that, without, if people don't have the knowledge of what these diseases are.
Yeah. Yeah. So definitely, you make a great point, and so it's sort of like the conjunction between, like you said, Maddie, you want people to be able to discuss it openly,
sure.
but at the same time, you want them to pick who they discuss it openly with. You guys are good. You're doing your part as far as stressing the importance of making sure that like that information is only accessible to whoever that patient wants it to be accessible to. Really big thing. And I think security, whether it's blockchain or two-factor authentication, that's definitely the right move as far as enforcing that.
Yeah, so I guess back to the blockchain being your view on what the future kind of holds for healthcare, how do you think that is going to get to be mainstream? I know healthcare can be pretty slow, and being so important with the health data that it needs to be very researched and proven. I guess, how do you see that becoming the big thing in healthcare? Is it a startup? Is it a big company that has to start it and then kind of approve it? How do you see it kind of sneaking its way in and becoming the norm, or just a different type of security that they use?
Right. Yeah. That's a great question.
And
Not one I don't have an answer for, but just one that's a very, it's a very complex answer.
mhm,
But, a lot of things come about, especially in healthcare, whenever it's been thoroughly tested, because you really can't take chances. Something like finance, like let's take the stock market, for example, it's predicated on risk. So we can take all the risk we want with like a startup or like Robinhood or something, right? But with healthcare, I do believe it will be a startup that sort of acts like a third party. So it offers healthcare centers sort of a convenient way to use the blockchain as like a storage of data.
mhm.
But I think one thing that's going to have to happen first is we're going to have to disassociate like the cryptocurrency world from the blockchain. Like in the public eye, at least, they're obviously separate. But in the public eye, we see like Dogecoin. We see, it's like it's a meme,
Right.
but
Yeah.
it really takes on like the precedence in people's minds when they think of the blockchain, because that's what's pushed towards them. So it's going to take a combination of media efforts to sort of change public opinion, and then someone to offer a very easy way for somewhat archaic traditional storage of information. They have to take that and then make it really easy for people to use. So I think that's how it's going to implement.
Well, at one medical facility that I worked at, our charting, we used our F keys to save things. And this was in 2018. like
F keys? What is that?
like your F1, F2,
Oh,
F9, like that is how like behind.
yeah, they just get comfortable, using one thing. And if it's not broken, don't fix it, right? But it's not broken, don't fix it until, someone hacks into it. So
Yeah, it's until something big happens that it's an issue.
I had never used an F key before, and I said, "What? I didn't know these buttons actually did something." So
yeah, they're very it's keyboard shortcuts essentially. So
Yeah.
well, thank you so much for coming on and talking about these complex things and breaking them down to bite sizes that
Yeah.
I can understand at least, which is a huge feat. Do you have, okay, we have a segment that we like to call
Just the tips.
Do you have any tips for keeping your data secure?
cool. I like it. Yeah, a few tips. My first one is do not name your password after a football team.
Okay,
That's a big one.
that's a great tip.
Yeah. Another tip would be don't share your password with anyone. And that goes for anything really. Even if you need to share your password with someone, write it on a piece of paper, show it to them physically. Do not send it over text. Don't send it over email.
Okay.
And then immediately after they've recorded it and logged in, rip it up and put it in separate trash cans.
The separate trash can.
Separate trash cans. Yeah.
Mine, I would have never thought about that because I always will rip it up and I'm like, what if someone really cares a whole lot and they piece it together? Separate trash cans.
There you go. That makes
Actually, it's in case like someone hacks into your account, and this is a piece of law that you should know is if someone hacks into your account and then they get your password from let's say your trash can after it leaves your house, you actually can't press charges because once it leaves your house, it's actually not your property anymore.
Oh.
Yeah.
Okay, well, there's no way for us to solve that problem. Okay, continue on to another tip.
Sure, yeah. Another tip would be
We just panic internally.
another tip would be, you don't have to become an expert on every subject, but it is important. The technology is changing really, really fast. I know it is a chore, but it's definitely important that people stay at least somewhat up to date on new technologies that come out.
Mm-hmm.
Do your own research on what's going on. Listening to this podcast is a great source of research, but make sure that you at least try to make an effort to understand what's going on.
Mm-hmm.
Don't become the person that's so far behind that it's too late to catch up.
Sure.
Yeah.
And I think finding someone that I had no idea what blockchain was until we sat down and you took out your forks and your knives and your salt shakers and explained what blockchain was. And I think especially, Kyle's an engineer, I am not. And tech isn't really my forte, or at least it didn't used to be. And so when I found someone that could explain it and break it down and take that time, whether, that's in person or watching videos or, reading things that are broken down, I think that is so crucial because it is intimidating to try to find that information at a level that you can comprehend.
Understand. Yeah, I think there's a lot of stuff out there that uses, you kind of have to be at a certain level to even understand that, and
that's what Ritchel's so great at, is making it understandable.
Yeah.
Yep, that's my bread and butter, breaking it down.
All right, well, we appreciate everything and we will talk to you soon.
Yeah, well, it's good talking to you.
Definitely. All right, guys.